We are discussing the sacroiliac joint in this video and going through the best exercises for it. Hi, my name's Rob from AMR Physio, and the sacroiliac joint is where the lower part of the spine, the sacrum, attaches to the ilium at the pelvis, giving the name sacroiliac joint or the SIJ. This is a very stable joint with limited movement here, but it's not uncommon to get pain due to this joint just like any other joint. A lot of the time, the pain can be one-sided, or sometimes it can feel like it's across the back. This can come on due to trauma, sometimes a slight bang on the pelvis, or a bigger accident. And other times it's more of a prolonged build-up that brings pain from a repetitive activity. It's actually quite a tricky one to rehab, as people tend to respond very differently to exercises. So one exercise that may help one person loads actually irritates pain for the other. And this can be really frustrating for people if searching for exercises to do for this, and some of the exercises suggested are really helping, but others hindering, and it can leave you a little bit stuck. Basically, for some people, it's almost as though they tend to find the joint feels less stable, and this would generally benefit more from strengthening and stability work, whereas others may feel it's more tightness affecting it, and they would prefer stretching exercises. And each of these may find the other type of exercise more provoking, and then even for others, they can find doing a mix helpful. So with this in mind, we've split the exercise into strengthening and stretching sections. And what we would say is this is not a prescriptive plan to do every exercise, but do the ones that make it feel good and just take any out that feel aggravating. If more in an athletic and active population, or it's due to a repetitive task, then modifying activity generally tends to be the best route here, and deloading the area from certain activities to help things settle is best, and then doing a graded return to activity with the help of some of these exercises. So let's get into the exercises, starting with strengthening. For each of these, start at a level that allows around 3 sets of 8, and you want to be doing it every other day, gradually working to build up the reps and difficulty of the exercise. So number 1 is hip abduction, in the form of crab walks. For this, place a band around your feet, then in a slight squat position, lift the leg up and step to the side. Important to note for this is to not drag the training leg, but pick it up off the floor and step. Do an equal amount one way and then the other. Number 2 is hip adduction, and in the form of a modified Copenhagen plank. This can be a very hard exercise in its normal form, where you're sideways on and have your foot on a surface and lift the body up. Very effective, but difficult, especially if in pain already. What you can do though is modify this and come closer, so your knee or thigh is supported as you lift up. Find a position that allows you to work on this where you can hold it or do it for reps. Number 3 is glute strength, in the form of bridging. So lay on the floor and lifting your bum off the floor, working to contract the glutes at the top of the movement. You can make this harder by doing this on a single leg or by starting to add weight. Just make sure a gradual progression to not irritate symptoms. Next is the stretching section, and complete these for around 30 seconds, either holding or coming on and off. Do this a couple of times through the day, and something that you can repeat daily. Starting with Texas twists. So this is laying on your back, then bringing your knee over to the other side to offer a stretch around the SIJ. Repeat this both sides. You may find one side more comfortable, so adjust the range to not go as far if there's any irritation. Next is a single leg knee hug. So bringing one knee up towards your chest. Again, you can repeat this with both sides, but again, adjusting the range according to your response. If you find you have pain that's coming more into the leg with this instead, or you have some pins and needles or numbness into the leg, it may be that it's more down to the sciatic nerve. If you're feeling that's the case for you, then check out the video here, where we go through what sciatica is, the best exercise you can do for it, and important things to look out for that would need addressing.